Which of the following is not a standard precaution in infection control? So we're looking for which is not true. So therefore, we want to eliminate any choices which are standard precautions for infection control. And let's see if there's any that we could eliminate right away. So if we look at option A, hand hygiene, that is actually considered your number one standard precaution against infection. So if you wash your hands, if they have a question that says what's the number one best way to prevent infectious disease, hand hygiene is always your gold standard number one. So because we're looking for something that is not a standard precaution, we will eliminate hand hygiene. And let's see if there's anything else like that that we know right away we could eliminate. And looking at option B, the use of personal protective equipment, or PPI right here, that would be your gloves, your gown, any sort of contact, droplet, airborne, any sort of precaution equipment that you put on when a patient's on isolation precautions, or anything to prevent infection would be a standard precaution in infection control. So all of these things, your gloves, your gowns, are things to prevent the spread of disease or infection. So we will eliminate that because the question is asking which one is not used in infection control standard precautions. So now that we have A and B eliminated, let's take a look at option C and D and decide from here which one is not a precaution in infection control. So option C says safe injection practices, and option D says taking antibiotics regularly. So now between these, if we look at safe injection practices, you might not necessarily think of that in terms of infection control precautions, but then again, would taking antibiotics regularly be one of them also? And if we take a look at option D, taking antibiotics regularly, look at this regularly part. Regularly is like routinely, meaning that you take antibiotics every day. It's just like a routine medication you take, like a vitamin. And that's not true. Antibiotics should not be taken regularly, and therefore that would not be something that's a standard precaution against infection control. Yes, antibiotics could prevent an infection, but that doesn't mean you should be regularly taking them. That could lead to antibiotic resistance for the patient and the greater community, and we want to only take them when we absolutely need to take them. And if the infection is not bacterial in nature, if it's a viral infection, then this wouldn't even be doing any good for the patient. Therefore, this is not a standard precaution in infection control and would be the answer to our question. But what about option C? We weren't sure here what this would fit into because this doesn't seem like a typical standard precaution in infection control. But we know that this is not our answer for two reasons. One, what we discussed in option D here, taking antibiotics regularly, we know is definitely not part of infection control, so we can eliminate that. And then looking at option C, safe injection practices, safe injection practices could include something like using an antiseptic and alcohol swab to clean the site before the injection. That would be considered a safe injection practice, and by doing so, you're helping to prevent any infection entering the body by cleaning the site before putting the needle in to give the injection. And therefore, even though it might not be one that you'll think of as on a top level, the same way you would hand hygiene and PPE, it is something that can be used to prevent infection. So we can eliminate option C. And that leaves us with option D, taking antibiotics regularly is the correct answer to this question.